Hi everyone, welcome to Szenan-Balance Live. I'm Szenan-Balance from Szenan-Balance, the acupuncturist. I shared this live video into a Chinese platform on Facebook. So although it's in English, but I'm pretty sure that some of you may understand English. So it'll be interesting for you. So which means Chinese platform, you'll be able to watch an English live video and as well as Chinese live video. 所以呢，我把这个今天的比较特别，我想到哦，既然我们早上呢都会讲这个，对吧？然后我们就把它学在这个中文的。所以如果你会听中文的平台，如果你会听英文的话，你也可以看一下我们的这个我做了每天早上做的这个 live 的英文 ，OK。So how do you know this Chinese and English? It's simple. If you see, look at the title on the top or on the bottom. If it is English, that means this live video is going to be English. And if the title is actually in Chinese, you know the live video is going to be in Chinese. Simple, right? Hi, Veronica, and happy day. How are you? You back? Yes. Glad to have you back. Happy that you're on two platforms. One is in the Facebook, the other one is in Instagram. Thank you for supporting me. Thank you. Now, I'm going to share our topic today. Our topic is what causes fibroid. It's a very small topic, but it's quite important. It's quite important. Okay, I'm going to share. And one is in the I'm going to share a watch party on my Facebook. Okay, that's it. Yeah. Okay, let's keep going. Right. Now, yeah. Do you know, my question for you, do you know what causes fibroid? I did this topic last night in Chinese. So do you know what causes fibroid? You have a good guess for this. You can guess anything, anything, to be honest, because you may be right. Any guess is a good guess, and you may be right. Why do I say that? Okay, so I'm gonna tell you later on. Why do I say that? Okay, any guess, good guess, and why do I say that? Okay, one of my platforms stopped. I don't know why. It's in Instagram. Okay. Now, if you're here, please say hello to me, and if you're watching replay, you can put it up to about start from 5 minutes or 4 minutes. We'll start there. Okay, this is a live video, so when I see people come out, and I will say hello, and when there is no people come out, I'll just carry on with my topic. And sorry, I got a bit of runny nose this morning. Just happened. The thing is, because when I came in this room, it wasn't warm enough for me. I'm very sensitive. My nose are very sensitive with cold. Okay. So I make sure most of the time I make sure it's warm, and I keep warm. And today this room, when I walk in, it's quite cold, and the heater wasn't warm enough. But it's pretty good now. Turn it up already. All right. Well, anyway, let's start with our topic. Okay. Diet. Yeah, Veronica said diet. Good one. Hormone. Good one. Yeah. How about you? Happy day. What do you think what causes fibroid? What causes fibroid? In Peru, they say allergy to humid. Allergy to humid. You see, allergy to humid. I will tell you anything will be right. Why did I say that? I'm going to tell you later. I'm going to let you know why do I say that later. Okay. Okay. Let's start. To be honest, okay, you go to your textbook way back in medical school, or you ask any of the doctors, specialists, fertility specialists, surgeon, OBGYN specialists, gynecology, any practitioner in this topic, you ask them what causes fibroid. They will tell you. If they say you 100% is from blah, 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 they are wrong. So therefore, I won't tell you in this live video, I won't tell you that I'm not in a position to tell you what really causes fibroid, because we don't know. Because we know a bit, but not everything. We know a bit, but we don't know everything that causes fibroid. So it's still unclear why fibroids develop. But there are several factors that may influence their formations. Okay, so we only be able to talk about what has been proved or what we know so far. Okay, so whatever you said just now, like Veronica mentioned about hygiene, hormone in Peru, and they said about allergy to humid, hormone, and diet. Yeah, could be all right, because what happened in here is we don't know. We actually don't know what really caused it. Okay, so anything is possible. Anything that you mention in your mind is possible one of the cause for fibroid. Right now, although that way, we need to discuss. Most people think what is the most common factors? Okay, hormone. Okay, hormone imbalance. So what sort of hormone imbalance in this case in fibroid? Estrogen and progesterone. So those two, estrogen and progesterone, are female hormones, right? We all know that. So that is so with hormone, what they are both hormone, the female hormone, and there are other hormone that is actually male hormone. I want to let you know, mention one more time. We discussed this in PCOS. Because PCOS is hormone imbalance too, right? But in PCOS cases, the male hormone so high and the female hormone's low. And this one is different. It's so different. It's the opposite. It's the female hormone overproduce, or the female hormone is so it's normal, but it actually form fibroids. So who knows? You have a normal hormone, but you have fibroids. You suffer from fibroids. And in that other cases that estrogen and progesterone are high, and that causing your fibroids. So can we say that it's 100% that hormone, the female hormone increase that causing the fibroids? No. Why can't we say that? Because not all female who suffer from fibroids had increase in estrogen and progesterone. And for those who have normal estrogen and progesterone, some of them, they suffer from fibroid. So how could you tell? So, but we know that when you have fibroids, the estrogen and progesterone tend to get high. Okay, so that is why we can't say that, well, it's definitely the hormone causing fibroids. But we know most of the case when you have fibroids, the hormones are out of balance. Does that make sense to you? So to be honest, we're still not clear what's causing fibroids. We already know that the hormone is one of the factors. There's one of them. But what caused the hormone out of balance? What caused the hormone out of balance? Well, there are many things that can cause hormone out of balance. Just like you mentioned just now, diet, the environment, stress, all of this can cause hormone out of balance. Then which means all of these factors could be one of the factor in causing fibroids. Does that make sense to you? So we're talking about lifestyle now. It's not one thing, But yeah, estrogen and progesterone, okay, they cause the uterine lining to regenerate during each menstrual cycle, and those two hormones may stimulate the growth of fibroids. That we know the fibroids grow from the cell, a certain cell, okay, that it got stimulated, and then it go bigger and bigger and it become fibroids. It's actually a tumor. Okay, it's actually a tumor. Okay, but this tumor is not cancerous. It's not a cancer. Okay, it's not a cancer. Okay, the second things that causing fibroid is pregnancy. Oh God, pregnancy is one of the factors that cause fibroid. What? Pregnant is not a disease. Pregnant is not a disease. And how could you prevent it? Okay, I don't want to suffer from fibroids, so I stop pregnant. It's not a disease. And that's because when you get pregnant, it increases in production of estrogen and progesterone in your body. This is the reality of pregnancy. This is the reality in hormone production in your body when you get pregnant. So we just mentioned about the hormone, and we mentioned about that estrogen and progesterone. It actually stimulate the regrowth of fibroids, right? And because in pregnancy your estrogen and progesterone increase, then it may stimulate the growth of fibroids. So the fibroid may just start to develop and grow rapidly, faster, very fast, while you are pregnant. Okay, so I have a patient many years ago, friend of mine, okay, and she came in and had spotting. She was sure that she was pregnant and spotting. And what did I do for her? I do moxibustion and acupuncture. Those are the two things that I did for her. So, and then of course they run skin, right, all of the skin, and they found out, wow, the fibroid is getting growth, it's getting bigger and bigger and bigger and bigger, and they were worried about that. I said, well, there's nothing you can do about it, you know, it just live with it and say and keep monitor it, and with the moxibustion in acupuncture treatment, because they can't do anything. The Western doctor can't do anything, but we can do something. I'm not saying that I can get rid of the fibroid while you're pregnant and I'll just give you some herbs and stop its growth. I have no idea whether my treatment will work or not, to be honest. Okay, I can't tell the patient that, oh, well, I'll give you some herbs, I'll give you acupuncture or moxibustion, then we're gonna stop the growth of the fibroids and your baby will grow. What happened here is, because the increase of the estrogen and progesterone, so when that increase, and the baby need that, so baby growth and the fibroid grow too, because the fibroid got the estrogen progesterone, it keep growing. In this case, it's actually growth in the position that when a label come, when the birth come, when she give birth and the baby should go through the pathway, it's on the way to the vagina, so it can't go. When it grows, if it grows rapidly, and the baby won't have enough space, and then it's actually on the position that is preventing the baby come out. Right. So this is the things that's not good. Right. In the end, I think she was 35 or 36 weeks, and she had a cesarean. Go for surgery, C-section, and take the baby out. And then I think after a few years, and they decided to remove the uterus, hysterectomy. Okay, so that's on their choice. Okay, because they are more likely to they are more the other partner of the family is more, part of the family is trusting Chinese medicine and acupuncture, but the other part of the family is actually trusting the Western medicines, and that's on their choice. That because it's quite big of the fibroid, and they decided to remove it, the uterus, and then yeah, that is just one of the choice that they made, and we respect that. Okay, so in fibroid cases, really a lot of people, quite a lot of cases that remove uterus due to fibroid. Why is that? Because fibroid actually causing spotting in heavy period and unstopped period, and that can cause issues because you're losing too much blood. Okay, so I want to share with you in here is pregnancy is not a disease, but because of the increase of the production of estrogen and progesterone, and it can stimulate the fibroids growth fast, rapidly, so that is causing the problem. And fibroids. Okay. Now I want to tell you, not every fibroid will grow in pregnancy. Some of them have fibroids, and they keep monitored the baby growth. And the fibroid is not actually growth. The fibroid when growth is not getting any bigger due to the pregnancy, due to the estrogen in progesterone increase. You see what I mean now? So you can't tell that the estrogen and progesterone increase will definitely make the fibroid bigger. It's definitely those two hormone causing fibroid. You can say definitely. It's just one of them. It may not at all. It may not at all. Okay, that's why they need monitor when you get pregnant. That is why when you have fibroid, they want to see you every 6 months or every year, or firstly probably every 3 months, to monitor whether it's getting bigger or not. Okay, and again, not every fibroids cause symptoms. What we said about two symptoms, one is heavy period and hormone imbalance, right? Your hormones may be balanced. It doesn't cause any hormone imbalance or pain. It may not causing any pain at all, and it may not give you spotting at all. So this is important to know, right? A fibroid may not cause any issues at all. It just stay there. It's just in the body, part of the body. But most of the time, if it doesn't cause any symptoms, any sign, there is no sign for a fibroid, what do we do? We don't do anything. Just leave it. But can you do something for it? Yes, you can. You can manage the stress, eating healthy, the right diet, a lot of things that you can do, changing your lifestyle. Acupressure point. We're going to talk about acupressure point as we go. Not today, another day. Now, the last factor, of course, is actually family history. Now, see that happy day. Is it possible to come and learn more from you by travel to New Zealand? No, sorry. Veronica said, help me to answer that. You will learn a lot by attending workshop from Dr. Szenan-Balance. He give and help everyone. Thank you. Better attending his class. Yes, thank you very much. That is right. Yeah, Happy Day say that his wife fibroid is not causing any pain. Yeah, that's in reality. It's in reality. Not every of the thing that fibroid cause pain, And I do have a lot of patients come in for back pain or blah blah blah, and they say they have fibroid, and I ask them about, do you have any symptom like your period regular, and not causing any problem for them. And in this case, it's not like high blood pressure or diabetes. I never ask, do you want to treat fibroid in these cases? Because there's no need to. I tell them, if there is no symptom, just leave it. Just leave it. Don't worry about it. Unless you get some symptom, unless you really want to treat it, then it's okay. You come and I'll help you. Right? And they are not trying to have a baby, and there's not a problem, because what happened is, if they're in the age of 30 something or 40, just leave it, because when it comes to menopause, a lot of bigger chance, not definitely, okay, bigger chance that due to the hormone decrease, the estrogen and progesterone decrease, then the fibroid will shrink. It'll go smaller and smaller. Okay, so that is what happened. So you may not need any treatment for fibroids. Okay, the last factors, of course, is family history. Family history. Well, again, you see, when it comes to family history, they're blaming your mom, your grandma, your family, because we don't know what is the real cause. But it tends to that this way. Fibroids may run in the family if your mother, your sister, your grandmother has a history of these conditions, you may develop it as well. Okay. Now again, when it comes to family history, which means we don't know what the real cause of it. And one of my masters said it very well and said, well, when it comes to history, when anything that is unclear, we don't know what causing it. When anything comes, we say, well, it's the family history, it's running in the family, so you're gonna get it's from your family. You know, it's in the DNA. Guess what? It means that it's in your diet. It means that a lot of times, if you change your lifestyle, it will help a lot. If you read the China study, you know why I say that. The China study is a good book, very, very good book. And I do recommend that you read that because it talks about how diet linked to disease. How diet linked to disease, that is important, far more important. How you just changing your diet and it helps. I'm not saying that when you change your diet, you don't need a doctor, you don't need to see a doctor, you never get sick. It's not like this. But diet is one of the big causes of any disease. I'm saying that diet is a big, cause of any disease. But it doesn't mean if you keep a good diet, you won't get sick at all, because there are other factors. Diet is just one of the factors. It can come from stress. It can come from the environment, that where you live, too cold, too humid. Right? It can be any others. It can be from the medication. Right? That's it for today, and thank you for being here with me. And tomorrow, we're gonna talk about who is at risk for fibroids. So who is at risk for fibroids? And then the next day we're gonna talk about what are the symptoms of fibroids. Then further on, we want to talk about how fibroids diagnosed. Then keep going, we say, what treatment is good for fibroids in the Western medicines. What do they do? You know, you need to know this if you're a practitioner, what medication they do, what, and would they do surgery? You know, all this thing. And then apart from Western medicine, what can we do as an acupuncturist? You know, what do we do? And can you do exercise? Can you do massage? Can you do Chinese herbs? Can you do acupressure point for it? So those are the and what can be expected in the long term. So those are the things that we want to go through every day for about half an hour. Okay, and thank you very much for being here with me, and I'll see you tomorrow, and stay awesome. And I love you all. See you then. Bye. Let me turn off all the platform.